This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So, whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Welcome, everybody, to another episode of Fertile Talks with Dr. Yemi Famuyiwa. Today, I have a friend of mine, an exciting, dynamic physician. Her name is Erica Bove, and she is the founder of Love and Science podcast and the Love and Science movement. So, Dr. Bove, I'm going to let you introduce yourself, and we'll talk a little bit about what Love and Science is.
Absolutely. Thank you, Dr. Yemi. It's so wonderful to be here today. Um, I have wanted to have this conversation with you for so long because I am continually inspired by your passion, by your leadership, by your ability to practice, reproductive medicine in such a personal way. And, as I was a new attending, now I've been out for about a decade, I was in my clinic and really struggling with how to reach my patients. I felt like I was going through all the data, the studies. Most of these women were very educated women. And I really felt this disconnect. And I started to ask myself, okay, how can I do better, as we always do? How can I reach my friends, my colleagues, my patients in a way that's going to resonate and help them ultimately make empowered choices and have a successful outcome? And, at the time I was also, engaging in coaching for my own personal reasons, relationship coaching and parenting coaching. And so what I decided to do was start trying out these coaching sort of tools when I was doing my fertility consults, right? Especially in the context of bad news, the journey just got longer, all those different conversations, as I know you have, with your patients as well. They're very difficult conversations.
Yeah.
And all of a sudden, the connection got better, right? I started to see, we just know in our bodies when we're actually reaching patients. The connection was better. I could see the body language that they were really making their best choices that were actually in alignment with their values, not like, what does this fertility blog say I should do? Or what does this, Reddit thread say I should do? Some of them even PubMed, would go down the PubMed rabbit hole of like, what should I do? But
Exactly.
to really, to understand who these people are, what their values are, help them make empowered choices, help them to trust their bodies, and help them to really have successful outcomes. And so that's what I do, right? So I have my academic position where I provide the REI care, which I never take off my coaching hat. But I'm very passionate about my coaching practice, which is where I help people who already have a fertility specialist to really make empowered choices based on their values and to have better outcomes.
Excellent. So you ideally focus on physicians who are going
Yeah.
through infertility themselves.
Yes.
Right.
Yes, mostly physicians. It's so interesting because I am open and I do have clients who are non-physicians, but for some reason, I think the experience of being a physician patient is very difficult. I mean, we all
Yeah.
know from being patients ourselves, having loved
Yeah.
ones, but I think that message of like how to be a patient as a physician, I think that really resonates with people.
Exactly. So
Yeah.
now let me ask you this, since you do focus a little bit on physicians, um,
we all know that physicians, right? One in four, if not one in three, especially female physicians, have had issues of infertility and actually may have gone through assisted reproductive technology themselves. Can you
Yes.
comment a little bit about that? And in your opinion, share with me. I have my ideas why you think that is.
Yeah, absolutely. So it's so interesting. I mean, as I was training, right, I actually didn't know I wanted to go into our OBGYN and reproductive endocrinology when I was a medical student. So I was just paying
Right,
attention, right, as we do. And it was like, oh, female physicians, their training is so long and then they emerge at the age of 38 and they all have infertility. And that's kind of what we were taught is like, okay, it's all these long surgical residencies and fellowships, and it's basically the woman's fault for not, finding their partner sooner, freezing their eggs sooner or something. It's always like put back on the woman. And, as I've been, in attending myself and trying to help people build their families, it's not always the 39-year-old. It's often the 32-year-old, right?
uh-huh,
Who's had 3 or 4 Uplay transfers and nothing is taking.
yeah,
Sometimes it's even wives of male physicians have worse outcomes. I don't
right,
know if you were aware of that statistic. So, I started to just sort of ask the question, like, what is different about female physicians? Because I don't believe it's just deferred childbearing.
right,
Some of it is, but not everything. And so when you look at what's really going on, you have to account for all of the different variables, right? And so something I started to play around with is like, okay, I know we've always been taught that stress has something to do with it, but stress is very hard to measure. How can we actually start to get a leg up on stress? And what tools do we have that actually help people get back into their bodies, help to process their feelings, help to truly release the stress that they're holding, the hypervigilance. I mean, I think that's one
right,
reason I love to help female physicians is because when we are trained as a doctor trying to
right,
play the role as a patient, be a patient, our
right.
doctor brains just won't stop talking.
It won't.
And so, right? So how can we connect the two, connect the mind and the heart, remind ourselves that we are human patients even if we have all this medical training, and how can we, bridge that gap to ultimately be more successful?
Yeah,
I think our stressful jobs, I think that's part
right,
of it is that we work long hours,
right,
dysregulated sleep, but also that it is so stressful to be a physician patient. And so many of us haven't yet figured it out how to do that in a
right,
way that is kind to our bodies, kind to our nervous systems, and ultimately our
right.
physiology for receptivity.
And also, we do know that females in surgical subspecialists, trauma, ortho, GYN,
Yeah.
also have higher than those rates we're talking about.
Yes, absolutely. And so there does seem to be something. And I'll tell you anecdotally, I know we need studies, but like when people reduce their clinical load temporarily, when ER physicians go to per diem instead of working all these dysregulated shifts and changing their sleep schedules and everything, that's when you start to see that people's outcomes they improve. And I think we have to make room in our lives for this. We
Right,
have to figure out a way. And sometimes that's really finding our voice. Sometimes it's setting boundaries. Sometimes it's reminding ourselves if we had an appendicitis, we'd be out for 2 weeks. And so why can't we give ourselves that same grace as we're undergoing IVF? There's
right.
all these different ways to think about it. But as female physicians, we don't give ourselves permission to be patients.
Yeah.
And so
And
much of this is to give ourselves that permission to be human
right,
beings.
right, right. And it's not just we ourselves giving ourselves permission, but sometimes in the medical field itself,
Yeah,
doctors are not always supported. Like,
that's true.
I don't know about your experience, but I know that when I had my first child, I was in a hospital that provided lactation support. We could go breastfeed in a separate room. We could receive the lactation consultation without any questions. We had people come help when I had my first child, my second
Mm,
child, and I had to be in the ICU, and they sent
mm,
someone home to help me with that. Um, so I think you're right. Um, I think that doctors are not always taking the time, because we're so ingrained to care for everyone, right?
yes.
And sometimes you need to refill your own cup.
Yeah. Yeah.
And
And
patients need to
I
see their doctors as human beings too.
That's right. And it's hard, I think, if you're a fertility patient and you're very attached to your doctor, it can be disappointing. Like, what? Like, they're not here this week. I got my test results. I want to talk to my doctor.
Yeah.
And my response to that is I promise you you're going to get a better version of me if I take just a little time away, or
Right.
I remind my patients that, like, I am not I'm committed to you fully, and my clients too, I'm committed to you fully, and in order for this to be sustainable for me, I need even mini breaks from time to
Yeah.
time, to kind of recharge and
Mhm.
find myself. And I think that we need to create that culture. I think if we lived in a society where that was the norm, like where you had the support, it sounds like you had very good support in some contexts. If we had that, I think it would be a lot easier for us. But I think we are still in a society where we're trying to do all the things for all the people all the time. And at some point, there's a limit. I think at some point,
Yeah.
our bodies just,
Yeah.
our cortisol levels are through the
Yeah.
roof, and we're trying
Right.
to take care of patients. At some point, there's a breaking point.
Yeah. I like what you said about you will get a better version of me.
Yeah.
I think we need to say that loudly because sometimes patients think that, well, if I can just dominate your entire 8 hours and I won't let you get up,
Right.
you're not getting good care.
Right. Exactly. That's so true.
You're not
That's
letting
so
your
true.
doctor come up for air.
That's right.
So you're getting a fatigued mind. So letting them attune, retune, come back calibrated, come back full, you might actually get better care. I think I see that sometimes um, in my practice as well. But it's great that you touch on that.
Well, it's interesting because you were in solo practice, right? So, and I know because my urologist father, right, he was in solo practice for most of his career. It's hard, right?
Yeah,
It takes some creativity. There are times when you're depleted, right? There are times, I'm
yeah,
sure, when you've needed to be a patient yourself or your family
yeah,
member, and we have to figure that out gracefully.
yeah. And sometimes it's getting the right people around us. Like
That's
my
right.
my staff are fiercely protective of me and of my time. And my office manager will say, "No, you need to go get some rest. We need to schedule this. We need to block this time."
Yeah.
Taking that extra time off where I can go kind of be with my thoughts and I
Yeah.
come back fuller. Yeah,
Yes. One of the mantras we say at Love and Science is, I deserve to be a patient, which is so interesting because if you think of these fertility appointments, they're not like, we don't generally need whole days off, right? We need just like these little chunks of time. But I always say, okay, if I was like getting chemotherapy, if I was doing something else like this, I would be asking. But the funny thing is, I think we tell ourselves, oh, we're not going to be a good team player. Oh, we're not going to be pulling our weight. Oh, they're going to judge me. I mean, my experience with female physicians is usually we over deliver, right? And so
yeah,
I've noticed that most people are quite able to be very productive, and take time off. I do think that if our bodies are truly depleted or stressed, we can talk with our, managers and figure that out. But I think sometimes we think, oh, but we're going to be a drain on the team, et cetera, et cetera. My experience has been that people are generally not that way. But I
yeah,
do think we have to remind ourselves that, like, I think at least, when I was training, it was like, and probably you too, is like, oh, we're these superhuman figures, and we have to remind ourselves that, like, we are whole human beings, we are having a human experience, and
yes,
how can we both serve our patients at a high level and ask for what we need at the same time,
yes.
and they're not always mutually exclusive.
You hit upon it. I think you and I have had this ongoing conversation where there are different seasons to your life as well. And prioritizing your time, your family time, makes you a better person because some people think that I can sacrifice all that time and I'm going to be a better this or more successful that. But there are different seasons. Like to your point, yes, I'm in solo practice, but when my kids were small, I used to literally block time on my office schedule when my kids had recitals because they were important to me. And
Yeah,
now they're past that phase. I don't get a do over. I can't get to make those recitals anymore. So
that's
taking the
right.
time to love yourself is critical. But you and I talked about having the parasympathetic focused body, right? We talked about that. And you said something about that in your coaching. Touch a little bit for our audience
Yeah.
on what we mean by this.
Sure. So there's the sympathetic nervous system and the parasympathetic nervous system. And if we think about it, like fight or flight is sort of what we think about when we think about the sympathetic nervous system. I think about, okay, I'm being chased by a bear, right? We all evolved. So we have to think about what our ancestors were dealing with. And they
Yeah,
truly had like predators in the wild. And so when we're being chased by a bear, it is very useful that our cortisol shoots up, our adrenaline is, released, that
yeah,
we can like we get this surge of glucose so that we can all of a sudden run away from the bear. But what happens is that's an acute stress. That's a very protective mechanism. But what happens is when we have chronic stress, and I think any of your listeners will acknowledge that infertility is a chronic stress, right?
right.
Sometimes the journey is, you know, not just months, it can be years, and it can be very, very stressful.
Yeah,
The threat of not having a child, not building the family, that's like being chased by a bear every single day. And our,
right,
our our bodies, our nervous systems are not wired for that, right? It's just it starts to steal more than it
right,
helps. And
right,
so we have to remind ourselves that even in the face of this really difficult thing that is infertility, that we have to shift the balance from the sympathetic nervous system tone, which is like I'm being chased by a bear, to the parasympathetic, nervous system, which is the more
I
calm,
am
the
safe.
rest and digest. Right.
Yes, I am safe. I am
I am
safe.
safe. I'm safe.
I'm in a
So
safe
there's
space.
different ways to do this. Deepak Chopra called this the relaxation response. And the fascinating thing, and this is something we do a lot at Love and Science, is we do deep breathing exercises
Right,
together. There's lots of wisdom traditions that, if you look at Ayurveda and the fiery breath and all of the different ways that we can tap into our bodies, so many of us, especially female physicians, are so cerebral that we're just like in our brains and thinking and ruminating and planning. But when we can actually drop into our bodies and slow down the thoughts, slow down the nervous system, remind ourselves that we're safe, that's when that sympathetic tone starts to come down. That's when our heart rate starts to come down.
right.
That's when our blood pressure starts to come down appropriately. That's when we digest a little bit better. It's when we can actually rest and recharge. And so, what I've found in my patients and my clients who are able to get into at least not, if not all the time, we need both, but to have moments and times when they're in more of a parasympathetic state, those are the people where the embryo transfers tend to work better. They have a more enjoyable experience of
Right.
their lives. They're able to notice the joy that happens every single day. They're better able to connect with their family members because they're not so hypervigilant all the time. And so, there's so much data about increasing the parasympathetic nervous activity and ways to do that. So many tools, we talk about at Love and Science. One of them is trigger mitigation.
Yeah,
Even walking through a fertility office door can be stressful and triggering for people. And so just I do visualizations ahead of time and I'm like, okay, how do you want to arrive when you come to the fertility clinic? What energy do you want to bring? What energy do you want to embody? And so if somebody says, okay, I want to feel calm, I want to feel grounded. Then we start to think ahead of time. You're excellent with this, Dr. Yemi, in terms of your mantras. Like, okay, well, then what mantras can we cultivate so that you can walk into your fertility clinic calm, grounded, confident, trusting, peaceful, whatever it is that people identify they want to be. We need to feel that in our bodies, and we usually need to cultivate our thoughts, align our thoughts to be in that state. And so that's what I found is that when we can sort of think about, figuring out what our triggers are, figuring out what really sets us off and keeps us at that activated state, when we can understand that and meet that with self compassion and really use these embodiment techniques and these mantras, that's really when the treatments start to work in the best
yeah,
way.
yeah.
Yeah.
Because when you overstimulate with cortisol, you cannot go from a hyper stimulated state to calm immediately
Yeah.
because that cortisol is a chemical
Yeah.
that needs to be metabolized out of your system.
So true.
So if you have too much cortisol, it's not going to just go away overnight. You have to digest, metabolize it, and not make more,
That's right. That's
not
right.
add more to it.
That's right. Well, it's
Interesting.
interesting. I have a client recently who said, I do okay in the morning. I wake up at 5 a.m. and then come 8:30, 9 a.m., all of a sudden I feel so anxious.
Mhm.
And she's like actually newly pregnant. And I like reminded myself, okay, when does the cortisol spike? I'm like, oh my gosh, that's like your first cortisol wave. And so I think it's a combination of her natural cortisol peaks and the fact that she's anxious because she's had losses before and she's newly pregnant. And so we're like, okay, so what can we do, partly to say, okay, cortisol, I see you. This is just your physiological bump, and I'm also going to do my very best not to make any more than my body needs, if that makes sense. So those are the kind of the ways
Exactly.
that we take the science and we talk to the science and we integrate it with our bodies so that we can start to thrive really and start instead of merely surviving.
Excellent. I like the way you said that. Talk to the science. I
Yeah.
love that. I love that
Yeah.
mantra. So, so you coach your clients through timeless beliefs, um, undergoing treatment. Um, how do you help them decide when to pause, when to reset? And can you share some stories with us of how this technique has worked for
Sure.
patients?
Absolutely. I think, most people who come to find me in my coaching practice are already feeling hopeless. They're already feeling jaded. They've gotten a run of bad news, in a row, and they're starting to really wonder if this is going to work for them. And they start to feel very threatened, right? They're feeling threatened that they're not going to be able to have a child, that they're not going to be able to build their family. And that's a very, very difficult state to be in. And so the first thing that we do is we calm the nervous system, right? We create a safe space. We help to as we metabolize cortisol, we actually metabolize the feelings. And what I've learned is, we can start with, the sort of all the academic stuff of this is what you do and this is these are the exercises, but until the nervous system is calmed down, none of the stuff works quite in the same way. And I think that's what I discovered, from my early attending days of like, okay, why do these coaching tools really work? Because they help people reconnect with their bodies. So that's the first thing we do is I help people remember their deepest why, which is the reason that they're still on the journey. Because if they've come this far, other people drop out. Like, why are you still here? There must be a reason. There must be a desire in your heart. So we talk about that. And then we identify the values and the identity. So, like I'm sure you've seen, in your clinic, like there can be people who look very similar on paper, same AMH, same
Right.
uterine cavity study, same
Exactly.
semen analysis. But when you talk with the person, you talk with the couple, when they have different values and priorities and desired family size and all those things, we might go in very different directions because we have to understand the values and the identity. And I think part of why people are feeling so hyper vigilant is because we think there's like this one size fits all. Well, not we, but I think
Right.
culture has told us that there's
Culture.
this one size fits
Yes.
all approach and that's one thing I love about you, Dr. Yemi, is how personalized you make the care. So similarly in coaching, that's what we do and say, okay, what are your top 5 values? How have you shown those values exhibited in your life? How have you used those values to make hard choices? How can you remind yourself that you're a person who makes values-based decisions? So once we start identifying the values, then we start looking at what's in front of us in terms of decisions to be made, and then we start using the values as a filter for those decisions. And so that really helps to raise people's vibration. It helps people to make more empowered choices. And when people do make their choices, it's not just because they went eeny, meeny, miny, mo and chose something, but it's because they've been very thoughtful to say, this particular path at this fork in the road, this most aligns with my values, right? And that's when we really start to see people feel more confident in their plan, more trusting in their REI because they feel seen. And that's really when, if we hit another fork, it's like, okay, well then how do the values inform these sets of decisions? And I think, people make the most progress really in terms of success, I believe, when we start to kind of use the values as a filter for the decisions.
Very good. Awesome. So let me see. What do you think? What is next for love and science? What do
That's
you?
such a great question. Yeah. So, I still practice clinically and I adore my work, right? And at some point, there's a limit to how many clients I can personally take on because I'm one human being, right? And so, right now, I'm working on growing my team, which is very exciting because there's things that I'm doing right now that, other people can be doing. Just like you said, surround yourself by the right people.
Right.
And then I could do more coaching, which is my true love, group coaching and one-on-one coaching. And also I have this vision, because if I calculate that there's 100,000 female physicians in the US right now with infertility, but based on my math, which is actually a conservative estimate. When I look at that math, I'm like, how can I serve as many people as possible at the highest level possible? And to do that, I'm going to need a team. I'm going to need a team of fertility coaches who I believe in the power that I think there's a real strength in having somebody who's a physician coach who knows the science, who knows the nuances, who reads the studies, who, who looks, thinks about these things all day in various contexts. I really want a team of amazing REI physician coaches to be able to serve the people. And so
Ah,
that's what I'm working on. And to be inspired by you, on my list for this coming year is also
well,
to start writing my first book. And so thank you for that
great.
inspiration. I
Yeah,
can't wait to read
yeah.
your book. And
It's a labor of love. So I go home, edit, 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 edit.
I'm sure
But it's definitely cool. But one of the things I do talk about in my book is how the body internalizes the trauma, and let's face it, infertility is traumatic, and how the
it is.
body internalizes it, and how the body holds on to this trauma, and it manifests in them having difficulties. And I have patient stories that explore that actually as well.
I can't wait to read those stories. I
Yes.
think one thing that I haven't mentioned is the role of what I call authentic hope in my practice, both my coaching practice and my clinical practice. Is I think that so much of the time our brains filter for the negative, our brains filter for what's not working and all the bad news that's clustered together. We see those patterns, but we don't see the fact that we're generating good embryos, or that we have been pregnant before, or that we're young, or that our AMH is good. And so one thing that I help to bring out is like, okay, the brain is coding this as a slew of negative news all in a row. However, let's also bring up the reasons why it makes sense for you to carry on this journey. Right. And we start to look at those factors for authentic hope. So it doesn't mean that we're just pushing down the sadness, pushing down the disappointment, because that needs to be honored. But when we can also really connect with that authentic hope, which is hope grounded in science, of why it makes sense for me to believe in somebody, why it makes sense for you, Dr. Yemi, as their REI, to believe in them, right? We believe in our patients and our clients more than they believe in themselves. And so how can we give them that belief that is authentic,
Right.
that is real, so that they
Right.
can remember that they can trust their bodies so that this works again? So I think that's another key ingredient that I know you believe in wholeheartedly, but I needed to mention because that's so crucial to everything else.
Excellent. Thank you so much for your time, Dr. Bove. So, if our audience want to find you, where can they find you?
Absolutely. So the best place is my website. It's the most comprehensive place. It's loveandsciencefertility.com. My social media handles are under the same name, Love and Science Fertility. You can follow me on Instagram. You can follow me on Facebook. And I also have a podcast called Love and Science Fertility,
Uh-huh.
wherever you get your
Yeah.
podcasts.
Yeah. Thank you so much for this wonderful time and just this authentic talk. And I do
Thanks,
hope this
Dr. Yemi.
message reaches out to the people that need to hear it. And listen up, guys. If you're thinking about going through this, you're not alone. You can reach out and get some support. I actively encourage my patients to seek coaching, but very few will come out and do so. So if
Yeah.
this is the nudge that you've been waiting for, you know, just go on your internet and look up Love and Science and reach out
That's
to
right. And I
Dr.
just
Bo.
got CME approved. So when people do my programs, they will have some professional development funds that they can use for my services too, which I'm really excited
Excellent.
about.
That's really
Yeah.
good news.
Yeah.
Thank you so
Thank
much
you,
for
Dr.
your time.
Yemi. Such a
All
pleasure.
right.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.